Now, we did highlight a lot of these particular risk factors that could lead to chronic conditions like heart disease and stroke. And I wanted to bring up really the elephant in the room, which is this COVID-19 virus, this pandemic, because obviously a lot of the risk factors we are addressing also place one at a higher risk for severe COVID-19 through hospitalizations or even death. As it stands right now, we know that the vaccine has been critical in reducing the number of severe hospitalizations as well as death, and it's done a phenomenal job in that forefront. So I wanted to talk a little bit about vaccines, but not just the COVID vaccine, also the flu vaccine, given the current season that we're in. And as cardiologists, we've always known the importance of getting the flu shot. Each and every year, we advocate it for our patients to do so. And in fact, I personally don't have my patients leave the office without asking if they receive both their COVID-19 vaccines, possibly their booster, as well as their flu shot. So Dr. Baker-Smith, can you briefly talk about why getting the flu vaccine is so important every year? And should we vaccinate our kids against the flu?
Oh my gosh, yes. As soon as the flu season, as soon as the vaccines are available, my kids are getting their flu vaccine. Flu vaccination is the best way to protect yourself and your loved ones against the flu, and it's potentially serious complications. CDC recommends annual flu shots, and that begins at 6 months of age and older. And this is really intended to reduce the spread of respiratory illnesses. And it's also important to highlight that we're trying not just to protect, the general population, but particularly some of our more at-risk population, which is like our older patients and more vulnerable patients. So it's really important. And especially during this COVID-19 era, some of the symptoms may overlap. So again, it's really just important to make sure that individuals are vaccinated against the flu.
Has killed millions of people, and children have not been excluded from this. And especially in the last several months, as kids have gone back to school, started re-engaging in their sports, we've seen more children in the hospital that were unvaccinated be patients. So now that we're now able to include the 5 to 11-year-old group, if you can get it, sign up with your pediatrician and get it for your children. There's no, it's just go, do not pass go and get it for your kids, along with the flu vaccine as well. And they can both be given at the same time, because that has come up in my office as well.
People who are more likely to die of flu complications are also more likely to suffer from COVID complications, right? Asthma, COPD. Asthma is much more prevalent in Black communities. High heart disease, blood disorders, diabetes, kidney disease, liver disease, because they kill your immune system. These things all kill your immune system. The vaccine, if you have the same access to the vaccines that everyone else does, your chances are going to be better. Why? Because vaccines should build up your body immune system as much as it can, even if you're already compromised. And we've already seen the benefit of vaccines in certain populations. Take diabetics, for example. Diabetics who keep up with their flu vaccine every year and the streptococcal pneumonia vaccine every 5 years, right, have 3 times less hospitalization than others, right? The flu vaccine itself, if you give it to people who already have flu, they're less likely of getting ill from this. Yeah, they're going to have the ill, they're going to feel bad, but they can still get around and walk out, and they're going to recover a whole lot faster. There's a lot of data to support a lot of this. If you are in the hospital, you're less likely to be in a hospital. But if you gave the flu vaccine, not only did it reduce hospitalizations, death, quicker recovery, the impact, especially in diabetics, was immense. Right? Almost 80% reduction in hospitalization in people with diabetes and the flu vaccine. Right? Now, bottom line is, even though vaccines have helped people reduce or eliminate a lot of disease that were harmful, thousands, hundreds of thousands, maybe millions of people in the United States are still susceptible because they have not been vaccinated, right? So ABC does have a resource for you, a website, and you can actually contact any ABC member for this. Vaccines are integral for the health of Black patients. Vaccines work in the right type of hosts who have to have the right type of disease management, preferably disease eradication, These are things that we can all do together as a community. If you go to the host resources, and I urge that we all do, reach out and share with colleagues, friends, patients. You guys are now chat. You're the community advocates. You are now charged with going out into your community and bringing other people who couldn't be here today or should have been here today and would have been here today. You got to bring them in and show them, teach them as much as you can. Today we went through pathophysiology, we went through medical school, we went through social determinant of health, we went through public health, we went through an editorial, okay, about me. We went through a bunch of other things. Put that together, internalize it, go out to the community, be that community force to address these issues germane to us all, so we can not only have the equality, we can also have the equity by working together as a unit.
The good news is that the ABC has a host of educational resources that I urge us all to review. You know, reach out, share with colleagues, friends, patients, etc. The feedback will let us know where, when, and how to concentrate a community force to address the issues germane to us all and achieve equity. Things that we need to know to work and fight together, bring us all together as a community. We can achieve the equality and the equity and do a whole lot better overall. A couple quick points about adult vaccination, right? Even though the cases have been reduced or eliminated, vaccination really has a multifold effect. Once you vaccinate someone, the chances that their body will respond to that are huge, right? So what's going to happen is you're going to give someone maybe a piece of a virus or something else that a virus has that's broken or something like that. And what will happen is the body will fight that virus and build that immune system. Unlike what we were just talking about before with coronavirus, which actually kills you because your body hasn't seen it before and your body can't actually fight that system. The vaccination is a piece of the virus. So your body can see the virus earlier than it will be if you were to get sick. It will fight, it will come up with a whole immune system, a whole army, so that if you ever see a virus or even part of that virus or even something that remotely looks like that virus ever again, your body's going to develop a system. In general, adult vaccinations have been suggested. It's suggested that everyone gets a flu shot, and as healthcare workers, we're all pretty much mandated, if you will, to get flu shots every year. But this is especially true for pregnant women and people with diabetes. We totally suggest flu shot every year. Is it the flu itself? Maybe, maybe not, but the overwhelming stress on the body in diabetics and pregnancy can really be even fatal in some cases. So the annual flu shot is definitely recommended for everyone. A couple points on flu, since we were just talking about that. Flu is huge, but what's even more immense is the effect, the power we have of controlling that a whole lot better, right? Underneath there, it's written, take action to prevent the flu. That's pretty much the biggest thing you can actually think of. See, because if we can prevent, the overarching thought is that by using preventive measures, we can kind of contain the virus, contain it to the point where someone can actually overcome the virus, build up an immune system, and by killing that virus, I know I'm saying a lot of the same things because I really want to sink in, that you're not going to spread it. And if you don't spread it, we're not going to get the illness. You don't get the illness, you don't get the hospitalizations, you don't get the death, you don't get the big burden to people, to their families, to even multi-generational families, you know, people living at home, you know, you get the younger ones and people who are more susceptible altogether. You can cut a lot of that down just by prevention. Some of the preventive measures we talk about here would be, you know, wearing masks, washing your hands and, you know, washing them the right way, you know, 20 seconds, soap and water predominantly. If you can't, you can use alcohol, but preferably soap and water. Even death from the flu or asthma, diabetes, heart disease, obesity, kidney and liver disease, because they kind of do the same thing. If they're not working well, then the body's metabolism doesn't work well. The proteins don't work well. So even if you did develop antibodies and an immune response, and you need that immune response to kill the diseases, your kidney is going to pee it right back out. So you're essentially left with nothing. Your liver is not going to work right. So you're essentially left with nothing. If your heart's not working, you're not going to pump it around to where it needs to be. So you're essentially left with nothing. But remember, it's also the host. If you already have bad lungs from asthma, from COPD, and a weakened immune system, again, you're essentially left with nothing on top of an already compromised system, asthma, COPD. So we're talking about chronic diseases, right? So if you had these diseases for a long time, your body starts breaking itself down. So you get an illness on top of that. The flu vaccine is one of the vaccines that's been huge. And I mentioned earlier that, you know, diabetes, we recommend that you get a flu vaccine every single year. The flu takes people out big time. But we know if you do a flu vaccination in people with diabetes, you can dramatically cut the hospitalizations. In one study down here shown, 79%, actually that's more than one study, that's a pooled data from the CDC. You can cut flu vaccine, can cut hospitalizations about 79%. That's huge. And we know the longer people are in the hospital, especially in African Americans, especially if you tend to go into something called heart failure, because of all the stress on your system, the hypertension, the diabetes, and all the other things that popped up in your pretest